who is at risk of developing retina related conditions?
To be very honest, it can happen at any age. Just born babies, premature babies, patient having high minus power, especially above -3.
A lot of people are developing diabetes आज के डेट में. So is it necessary कि किसी को diabetes है तो उसको diabetic retinopathy होगा ही?
See, most of the patients having diabetes, they have diabetic retinopathy to some extent or the other.
Are you someone who has diabetes or have been diagnosed with diabetic retinopathy? If yes, then this is the podcast for you. Today we have with us Dr. Sangeeta Roy, a vitreoretina surgeon, and we will be discussing all about diabetic retinopathy. So tune in and give it a watch. Hello everyone. Welcome back to our podcast series. Today we are starting a new podcast series on retina related conditions. Today we have with us our in-house retina surgeon, Dr. Sangeeta Roy. She is an ophthalmologist with almost 10 years of experience and expertises in medical and surgical management of vitreoretinal conditions. Hi Dr. Sangeeta.
Hello.
Welcome to our podcast.
Thank you. It's a great pleasure to discuss about different aspects of retinal health today, and thank you for having me.
Of course. So, Dr. Sangeeta, it's been noticed that a lot of times India को refer किया जाता है as the diabetic capital of the world. So, India में and we've seen that India में diabetes constantly increase हो रहा है, and obviously as a result diabetic retinopathy में भी बहुत increase हुआ है.
So basically diabetes is a systemic disease. So ये पूरा शरीर में दो organs को mainly affect करता है, primarily the eye and the kidney. And among the eye, retina is much more affected. So it's very important to take care of your eyes if you have diabetes.
Right. So ma'am, जैसे of course diabetic retinopathy is on rise today and it's very important to discuss this topic, and especially I see कि awareness बहुत ज़्यादा कम है regarding this issue. People don't understand. A lot of people who are diabetes, they're not aware that उनकी आँखों को affect हो रहा है उनकी diabetes की वजह से. So but before we get into the nitty-gritties of understanding diabetic retinopathy, I think it will be great if you can tell us a little bit about retina, क्योंकि ऐसे तो हम आँखों के बारे में जानते हैं, but then we understand the lens and the eye, but उसके आगे that's where our knowledge is limited to.
So before we start about diabetic retinopathy, so it's important to know our eye a little bit more. So I have this model of eye. This is basically an eyeball model. So we have cut it in halves so that we can see inside. So first, that transparent thing, it's like called the cornea. Inside this, there is a small hole, as you can see from that side. There is a brownish tissue, that is the iris, and behind that is the lens. This is the lens where cataract is formed and we have to operate. And behind that, there is a cavity inside the eye, and it is filled up with a gel called vitreous. And behind that vitreous, there is a vascularized neural tissue, that is the retina. And what this retina does is, like when light falls in our eye, it passes through cornea, through lens, and it finally reaches the retina. Retina is a process those information and sends those information to the brain via optic nerve. So it is very important to take care of your retina.
Right. So basically आगे जो हमारा cornea है, आगे जो हमारा lens है, that helps to send the picture of the world to your eye, but it's the retina जो कि आपके image को convert करके brain में पहुंचा.
So to put it in simple language, if you consider your eye to be like a camera, so lens is like the lens of the camera and the retina is like the film of the camera. Right. So it's very important to take care of that film.
Right. So now that we know कि retina is such a important part. In fact, I've heard कि retina को हम heart बोलते हैं of the eye because it has of all these blood veins and everything, right?
And one more important thing, like in lens, we have when we develop cataract. So basically, we remove our natural lens, we replace it with an artificial lens.
Right.
But we can't do that same thing with retina. It's our own thing. It cannot be replaced. So it's very important to take care of it.
Correct. Matlab basically anything that happens in retina is not reversible.
It is reversible, but
Okay.
there are, every disease of retina has got certain stages.
Right.
But after a stage, it's very difficult to get the perfect vision and this thing.
Right.
Partly it can be corrected at that extreme stages.
It can be cured, not replaced with a
new
good
brand
retina.
new thing.
Right. So, मैम usually जैसे retina related जो conditions होते हैं, who is at risk of developing retina related conditions?
To be very honest, it can happen at any age. For example, like in very childs, like just born babies, premature babies, retina can be affected. As we call nowadays, it's retinopathy of prematurity.
Right.
In young age patients, fluid can be accumulated due to excess steroid use, stress, that can be affected. It's called CSR. Again, patient having high minus power, especially above -3. So they can have certain weak areas in the periphery of the retina, which can lead to tears, holes, and certain systemic conditions like diabetes, hypertension, and hematological disorders like anemia. All this thing can also affect retina.
Right. And of course we have the diabetes, which affects our which leads to diabetic retinopathy. Right. So all of this sounds quite scary, because retina is it's such an unknown topic to all of us.
So basically it's not scary. So what, as a retina specialist and ophthalmologist, we suggest, suppose when you are diagnosed with a certain disease, and if you're like in previous thing I said that we are having high minus power. So whenever you go for an eye checkup, you go for a comprehensive eye checkup. You dilate your eyes and check it. So if we can detect it in early stages, it can be managed. Nothing
Right.
like that. If I have diabetic retinopathy, nothing can be done. It's a totally myth.
Okay. We can always, there's always a solution, and it's best to diagnose it at an early stage. So, इसमें basically comprehensive eye checkup में whenever you dilate the eye, we check up the retina. And how often should we do this, ma'am?
If you're not having any symptoms or anything, for any individual, yearly retina checkup should be done. And if somebody have been diagnosed with diabetes or BP, newly diagnosed, as soon as you are diagnosed, you should go to an ophthalmologist and get your retina checked.
Okay, and then the ophthalmologist
decide along with the follow-up thing.
How often they need to come for the. Okay, that's good advice. Better be safe than sorry. So without much further ado, let's get into our main topic for today, which is diabetic retinopathy. So ma'am, can you explain us what exactly is diabetic retinopathy?
So basically in diabetes, as I previously mentioned, retina is a highly vascularized tissue. So it mainly affects the retinal blood vessels. So these blood vessels becomes excessively leaky. Leaky means fluid gets evacuated outside the retina. So there is fluid accumulation in the retina. Along with that, there is also some blockage in the vessels. So retina is not getting the nutrition which the retina should get. So it causes death of the retina, hypoxia, all those things. Mainly it happens because it affects the retinal blood vessel.
Right.
This thing leads to severe complications.
Right. But ma'am, जैसे आप देख रहे हैं, a lot of people are developing diabetes आज के डेट में. So is it necessary कि किसी को diabetes है तो उसको diabetic retinopathy होगा ही?
See, most of the patients having diabetes, they have diabetic retinopathy to some extent or the other. But as I discussed about the normal anatomical structure of the retina, so the center of the retina, which is called the macula, is responsible for 90% of your vision.
Okay.
So until and unless that part is getting affected by diabetic retinopathy, so a patient cannot diagnose this thing like I am seeing less, or if it is happening surrounding that center part, he is not or she is not aware of that thing.
Right.
So it's like in the early stages when the center part is not affected or not fluid accumulated in the center part, So the patient is like feeling like I am not develop any retinal condition due to diabetes, but it's
Okay.
not like that.
राइट, सो आपके कहने का मतलब ये है कि बेसिकली एवरी डायबिटिक पेशेंट विल हैव सर्टेन एक्सटेंट ऑफ डायबिटिक
At
रेटिनोपैथी.
least 80 to 90% have
80
what
to
we
90.
can see in our clinical practice. It's like that.
ओके, बट उसका एक्सटेंट इतना ज़्यादा नहीं होता तो उनको
रियलाइज नहीं होता, पता नहीं चलता
Right.
कि मेरे विजन में कुछ इफेक्ट. जब तक आपका विजन 90% सही रहेगा तब अब तो उतना पता नहीं चलेगा ना उस
Right.
चीज़ का.
एंड जैसा मैंने सुना है डायबिटिक रेटिनोपैथी में फॉर अ लॉन्ग टाइम ऐसा होता है कि स्लोली आपका विजन जा रहा है, आपको उतना पता नहीं चलता, एंड इवेंचुअली वन डे सडनली योर विजन falls quite a bit. So is that true?
The thing is that डायबिटीज़ का डायबिटिक रेटिनोपैथी का काफ़ी स्टेजेस होता है.
Okay.
So to broadly classify in our medical language, it's like a non-proliferative diabetic retinopathy and proliferative. Proliferative मतलब ज़्यादा खराब है उसमें, ठीक है.
Okay.
अभी नॉन प्रोलिफरेटिव में भी आपका 4 स्टेजेस आता है, माइल्ड, मॉडरेट, सीवियर, वेरी सीवियर. सो इन माइल्ड स्टेजेस patient do not realize anything, no symptom, nothing. So it's like ठीक है, मतलब सिम्टम नहीं है. मान लीजिए किसी को 500 शुगर भी है, ठीक है, तो उनको ऐसा नहीं कि 500 शुगर में हमेशा आपका स्टेज 5 ही पहुंच जाएगा.
Okay.
हो सकता है अभी डिटेक्ट हुआ है, उनका माइल्ड भी हो सकता है, तो पर वो देखने से पता चलता है एज यू एग्जामिन द रेटिना दिस थिंग.
ओके.
और जब सीवियर जैसे प्रोलिफरेटिव में होता है उसमें क्या होता है, रेटिना में एबनॉर्मल ब्लड वेसल ग्रो कर जाता है,
Okay.
एंड दीज वेसल कैन ब्लीड एट एनी टाइम. सो
Okay.
प्रॉम्प्ट एक्शन और इंटरवेंशन इज रिक्वायर्ड.
Right. So, ma'am, is there some kind of an early sign जिससे लोग पता कर सकते हैं कि उनको डायबिटिक रेटिनोपैथी डेवलप हो रहा है, इट्स अफेक्टिंग देयर विजन?
अर्ली साइंस तो ऐसे नहीं है, क्योंकि जब तक मतलब आपको पता चलता है कि विजन कम हो रहा है तब तक मान लीजिए आंखों में आइदर हेमरेज हो गया है, पानी जम गया है, मतलब
Okay.
सेंटर, जैसे मैंने बोला सेंटर विजन इफेक्ट होता है तो पेशेंट्स को पता चलता है.
So they get to realize
हाँ.
at a
डिलेड. इसीलिए हम लोग सारे एंडोक्रिनोलॉजिस्ट और ऑप्थेल्मोलॉजिस्ट भी बोलते हैं कि जब भी आपका डायबिटीज़ डायग्नोज हो, गो फॉर अ रेटिना चेकअप.
राइट, मेक सेंस. सो मैम, जैसे किसी को डायग्नोस हो गया, दे हैव डायबिटीज़, and are there any other risk factors that they should keep in mind कि उनको डायबिटिक
डायबिटीज रेटिनोपैथी अलॉन्ग विद द स्पेशली डायबिटीज का ड्यूरेशन एक इम्पॉर्टेंट रिस्क फैक्टर है. सो इन स्टडीज इट्स लाइक इफ यू आर हैविंग डायबिटीज, स्पेशली जो लोग टाइप 1 डायबिटीज होते हैं उनका काफ़ी यंग एज में जो लोग डायबिटीज़ होते हैं बिलो 20 और 18 ईयर्स, सो 5 ईयर्स अगर आपका ड्यूरेशन है डायबिटीज़ का तो आप स्पेशली एट रिस्क होते हो. एक तो है आपका पोरली कंट्रोल ब्लड शुगर, और यू हैव एसोसिएटेड हाइपरटेंशन, हाई बीपी ऑल्सो, एंड फॉर females when you are pregnant along with diabetic, that is also a risk factor.
Okay, so if they're pregnant and they're diabetic, so
they should get it checked.
Okay, that's something I'm hearing for the first time. So अब जैसे अगर किसी को, जैसे आपने बताया ये रिस्क फैक्टर्स, सपोज दे हैव डायबिटीज़, दे हैव टाइप 1 डायबिटीज़ और दे हैव blood pressure, so and they come to the hospital for a retinal checkup, so what exactly would be the procedure that they have to go through for diagnosing whether they have diabetic retinopathy or not, and what extent do they have it for?
So first we'll do a comprehensive eye checkup, like which includes first your vision testing, then your eye pressures, and then we dilate the eyes basically. So when we dilate the eye, we get to have a thorough vision of our retina, so we see, and if you're having such kind of signs in the retina like hemorrhages or lipid deposits and this thing, and if you're having diabetic along with high cholesterol also, that is also a risk factor for developing this. So after that, sometimes we go, if we feel like there is fluid accumulation and these signs are there, we go for a retinal scan, which is called the OCT scan. So this OCT scan has two importance. First is like to detect how much fluid accumulated in your retina, and because whenever there is fluid we go for treatment options.
Right.
So for treatment follow-up also this is important to check how the treatment has worked. So baseline scan also provide you the follow-up scan, this thing.
Okay, you can compare
This thing.
Right. And I believe there's one more thing called fundus photo.
Fundus photo is actually basically when we are explaining it to the patients. So see, whenever a first time a person is hearing all these things, it's very difficult to comprehend the thing. Photos helps the patient to understand
what exactly
is happening, and it's better for them to understand this
it's
thing.
for their understanding purpose. But OCT mainly, the scan helps you understand what is the extent of the damage and what is the treatment that we should be doing. Right. So talking about treatment, what kind of treatment options are available for diabetic retinopathy?
So basically whenever we see there is, as I told, that two stages, non-proliferative and proliferative. Suppose a person is in a non-proliferative stage but fluid has accumulated in the center of the retina.
Right.
So to address that, there are certain treatment options like we give injection, like through here we give injection inside the eye so that it acts here inside the retina. Okay. So there are different injection molecules and it depends on the ophthalmologist and your condition which one to choose. Another treatment option is laser. It is what we call PRP or pan-retinal photocoagulation.
Right.
Basically when a patient has developed in the proliferative stage.
Right.
So
which is the severe stage.
Which is the, to be honest, more severe stage.
Correct.
And what we do, we just laser the peripheral part of the retina, not the center part, peripheral part. It's like destroying the unhealthy retina.
Okay.
So that abnormal blood vessel ultimately shrinks and destroys.
Okay, this is when you have extra blood vessels.
Extra abnormal blood vessel.
Got it.
And if the patient comes to in that stage when that extra blood vessels in the proliferative stage has ruptured, then surgery is the option.
Okay, which is the last option. Are there medicines to treat this?
Medicines is like sometimes first if you have very little fluid accumulation, we can give one eye drop, but to be very honest, most of us prefer to give injection.
It's more impactful. Got it. So how exactly, suppose someone is at a risk of developing diabetic retinopathy, so how exactly can they reduce their risk of developing diabetic retinopathy, or maybe managing or keeping it at a low point and not letting it get into the non-proliferative stage?
So basically the main thing is, since diabetes is a systematic disease, so you have to control your blood sugar. That is the foremost thing. And sometimes we see patients like whenever they come for a doctor visit, they are not having sugars. It's like, I am having within 200 sugar. So they expect that my eyes will be fine, I will not have that. So another thing I like to mention is like hemoglobin, HbA1c or glycosylated hemoglobin.
Right.
This gives a picture how well your sugar is controlled in last 3 months. Okay. It's not that just 2 days I am having less carbs, less sugar and my sugar.
It's obviously a long-term thing.
So many patients have the tendency to like they have
obviously because less knowledge or incomplete knowledge.
इसीलिए तो ये बहुत इम्पॉर्टेंट है. और रेगुलर आपका जो लोग डायबिटिक है मंथली ब्लड टेस्ट करके चेकअप करना, प्रॉपरली चेकअप करना, क्योंकि कभी कभार क्या होता है घर पे हम लोग चेक कर लेते हैं, डेली करना ठीक है, एक एस्टिमेट दे देता है, पर लैब से हर मंथ एक बार टेस्ट करवा लेना चाहिए. ठीक है. और एसोसिएटेड अगर आपका ये हो रहा है कि आपका बीपी, कोलेस्ट्रॉल ये सब भी है, उस सब का भी ध्यान रखना चाहिए. सो बेसिकली कंट्रोलिंग योर शुगर इज़ द मोस्ट इम्पॉर्टेंट थिंग. एंड जैसे हम लोगों ने स्टेजेस डिस्कस किया, माइल्ड, मॉडरेट, सीवियर, तो उस हिसाब से फॉलोअप भी आपका डॉक्टर, रेटिना स्पेशलिस्ट या ऑप्थेल्मोलॉजिस्ट डिसाइड करते हैं. किसी को 6 मंथ बोलते हैं, किसी को 2 मंथ, किसी को 3 मंथ. So you should go for checkup at that stipulated time only.
Right. Yeah. Because timely intervention is very important.
Very much important.
And so I believe जो आप बोल रहे हैं, to reduce this risk of diabetic retinopathy, हमें cholesterol, sugar, BP control में रखना होगा. So it basically in a nutshell means that you need to get into a better lifestyle. Better fooding habits, better nutrition. Okay. So would you like to, finally, while we're wrapping up this podcast, would you like to tell our viewers, anyone, be it someone who does not have diabetes or who's not at risk, how can they, keep the retina healthy?
So basically, first and foremost thing, as we discussed, एक healthy lifestyle आपका चाहिए उसमें. और मान लीजिए कुछ कंडीशंस जो हम लोग, रेटिना का हेल्थ हमारे हाथ में नहीं होता है ऑनेस्टली. जैसे किसी का हाई पावर है, ये सब कुछ तो प्रीमैच्योर बर्थ, ये सब तो हाथ में नहीं है, उसका तो चेकअप और फॉलोअप ही होता है. पर कुछ लोगों में एज में जैसे कुछ कंडीशंस होते हैं जो हम लोग बोलते एज रिलेटेड मैक्यूलर डिजेनरेशन. इस सब कंडीशंस में आपका जैसे ड्राई फ्रूट्स, नट्स वगैरह, ये सब लेने से एटलीस्ट वो डिजीज वहाँ पर हॉल्ट होता है, ये सब बेटर
डिले हो जाता है.
हाँ.
Okay, that I think this was a fantastic episode, doctor. You gave us a lot of insights into diabetic retinopathy. In fact, we got a lot to understand about retina. So thank you so much, and it was a pleasure having you here with us.
Thank you.
Thank you everyone for tuning in. Don't forget to subscribe and share with your friends and families. And until next time, take care of your eyes.